Welcome to Infection Navigator. Today is April 25, 2025. Around the world, the landscape of viral outbreaks continues to evolve, challenging healthcare systems and demanding public vigilance. From the resurgence of diseases once thought contained, to the emergence of new threats, the current state of global viral health warrants our close attention. In the United States, a disease that was once nearly eradicated has returned with unsettling force. Measles, known for its high transmissibility, is surging again. Over 800 cases have now been confirmed across 24 states. Texas leads the numbers, with Gaines County at the epicenter, where communities have seen rapid transmission, particularly among young children. The vast majority of those affected, upwards of 96%, are unvaccinated. Experts point to a significant dip in MMR vaccination coverage nationwide, with the percentage of immunized kindergarten-aged children dropping below the herd immunity threshold of 95%. This decline has created fertile ground for the virus to re-establish itself. Public health forecasts suggest that, if this trend is not reversed, the United States may face a future where measles becomes endemic again. Some models even estimate millions of potential infections over the next few decades if vaccination efforts are not aggressively restored. Meanwhile, in the United Kingdom, health authorities in Cambridge have launched an urgent investigation following the arrival of a patient with mpox at Addenbrooke's Hospital. The patient had unknowingly exposed more than 50 individuals, including both medical personnel and fellow patients, to the virus. Mpox, often confused with smallpox due to its clinical similarities, is a zoonotic virus that causes fever, body aches, and a signature blistering rash. While outbreaks have been reported sporadically, the current concern revolves around a specific strain, Clade 1b. This more transmissible form has been predominantly circulating in Central Africa and is now drawing international attention after recent mutations were observed. Globally, it has resulted in over 25,000 confirmed infections and nearly 1,000 deaths, prompting increased genomic surveillance and testing protocols across multiple countries. Elsewhere, cruise ships have become hotspots for gastrointestinal outbreaks. Most recently, the Viking Polaris, a luxury liner, reported that more than 30 passengers fell ill during a 2-week voyage. Symptoms included nausea, vomiting, and diarrhea, strongly indicating a norovirus outbreak. Investigations are ongoing, with the Centers for Disease Control and Prevention closely monitoring the case. This event is not isolated. In fact, since August 2024, over 2,400 cases of norovirus have been reported aboard various cruise vessels. Contributing factors include shared dining areas, recycled air, and limited onboard isolation protocols. These incidents serve as reminders that even recreational environments remain vulnerable to rapid viral transmission, particularly where large groups gather in close quarters. Turning our focus to avian influenza, the H5N1 virus continues to raise alarms, especially in the United States. Since the start of the 2024 outbreak, authorities have recorded 70 confirmed or probable human infections. These cases have largely involved individuals who had direct or indirect contact with infected livestock, particularly dairy cattle and poultry. Beyond the human toll, the virus has devastated bird populations. Over 12,000 wild birds have tested positive, and more than 168 million domestic poultry have either died or been culled to limit spread. While no evidence of sustained human-to-human transmission has emerged yet, virologists warn that the virus's genetic shifts must be monitored closely. The risk of a zoonotic spillover event triggering a larger pandemic remains ever present. In light of these developments, experts stress the urgent need for strengthening public health infrastructure, both nationally and globally. Increased funding for surveillance programs, renewed emphasis on vaccination education, and coordinated international data sharing are all critical components of outbreak preparedness in this era of interconnected risks. As viral dynamics evolve, so too must our collective readiness. What links each of these outbreaks, from vaccine-preventable illnesses like measles, to emergent zoonoses like mpox and H5N1, is a fundamental truth. Prevention begins with awareness, and vigilance saves lives. Thank you for joining Infection Navigator for this vital global update. Stay safe, stay informed, and keep navigating the data.